The Director of Public Health today refused to name the clinics visited by a North Shore mother who later tested positive for coronavirus. But one of those clinics, revealed after the Ministry's press conference, says it followed public health protocols. The mother, who is now at home in isolation, flew home from Italy via Singapore last week. She felt unwell on Monday and flew returned to Palmerston North that day on Air New Zealand. The woman visited 2 medical clinics that day. A doctor at the first unnamed clinic gave her antibiotics. A doctor at the second, which has been named as the Westgate Medical Centre, took swabs, and those test results yesterday proved to be positive. A staff member at that clinic has spoken to the New Zealand Herald today, saying they were concerned the woman's visit put other patients and staff members at the clinic at the time at risk. Westgate Medical Centre is affiliated to Tamaki Health. Its services are contracted to ProCare. We'll speak to its clinical director, Alan Moffat, after 6 tonight. But in a statement from Tamaki Health, its CEO, Stefan Crawsor, says we follow public health protocols for managing the care of suspected or confirmed cases of COVID-19. We have signs on the door asking people not to enter if they have been overseas within the last 2 weeks. They should phone ahead of any visit. We confirm a woman who suspected she had COVID-19 attended our medical clinic late on Monday afternoon, 2nd of March. She presented as a walk-in to urgent care and was seen in a short period of time. Once the patient identified herself as having returned from overseas and was showing COVID-19 symptoms, all clinic staff followed Auckland Regional Public Health Service protocols. Mr. Crawsor says the doctor who treated the woman has taken leave and will remain at home until March 16. He says no other staff were in close contact with the woman and they remain at work. Meanwhile, our reporter Katie Doyle went to the Westgate shopping centre to find out what locals think about the situation.
You get to my age, you don't really worry too much, you know what I mean? It's either going to happen or it's not. What do we do? Hey, most people have got to go to work, got families to look after. We can't just all hunker down, can we?
How does it make you feel knowing that, someone may have been around here with coronavirus?
Oh, it's really worrying, really concerning, yes. Yeah, I wish they'd have told us sooner what had happened, because apparently they didn't tell the nursing staff either. So, no, it's very concerning. We've actually just cancelled our trip to Japan because we've actually booked on the Diamond Princess. So, it ended up getting cancelled before we cancelled it, so, yeah.
It's gone mad around the world. It's clearing out supermarkets is ridiculous because the world's not going to end because there's a flu. The Asian flu, I had the Asian flu in 1957 in the UK, and I think about 40,000 people died there. 1 million people died around the world. At the moment, there's a German measles epidemic in the UK, but nobody talks about that. So, no, people are getting carried away.
Would you, knowing now that there is one locally, would it stop you from coming out?
No. No. No, we'd still come out.
I don't think it's too much to worry about at the moment. I think they should be putting more controls on the border to stop more people from these countries coming in, like Italy and Iran and places like that, and China, where it's really quite bad here.
Honestly, I feel scared for myself and my family. It's pretty scary because you don't know who has it. Yeah.
Would it stop you coming to a place like this?
It would actually. So yeah, it would stop me going to places. I fear for myself and all, and my health and all. So yeah, it would stop me from going to places.
I'm just still going where I'm going, but I know, like in places like in the bars, in pokies, in the buses, where it's a close knit. Also the hospitals. It's a lot of places. It just depends. Look, if I'm going to get it, I'm going to get it. There's nothing I can do. It's the same as that. It's if I'm going to die today, I don't know I'll die today.
And that was Katie Doyle speaking to Westgate locals.